This is Bob and his daughter Hannah. Bob has decided to begin palliative sedation due to his painful terminal illness. Hannah is not very happy with this decision and has asked to see the doctor. Hi, Hannah.
Hi.
I'm Dr. Bowers. Nice to meet you.
Nice to meet you.
I heard you wanted to discuss your father's decision in starting palliative sedation.
Yes, because I am very upset. I feel like he is just giving up on his life and just trying to terminate himself, and I just don't understand.
If you'd let me, I would love to explain what palliative sedation is and why we use it.
I think that would be a really good idea.
Palliative sedation evolved from the practice within palliative care. It's the monitored use of medications to induce a state of decreased or absent awareness in order to relieve the burden of otherwise intractable suffering in a manner that is ethically acceptable to the family, patient, and healthcare providers. You probably hear a lot of people call this terminal sedation, and it's just another phrase used for palliative sedation, and it's very misleading. The term came about because palliative sedation is used for the terminally ill. It's often misinterpreted as being the purpose of terminating life.
Sounds an awful lot like assisted suicide. Can you please explain the difference?
Of course. This is actually a very common question. So, palliative sedation versus euthanasia, which is assisted suicide. Palliative sedation really is for the control of symptoms, and euthanasia is to end their life. So really we're just trying to make the client comfortable and be able to stand their symptoms.
So how do I know that palliative care is the right route for my dad?
So pain and dyspnea are the two most common indications for palliative sedation, and your father happens to have both. Prior to treatment, consent from your father is required, and we are going to make sure his advanced care planning is all completed as well.
Will I ever be able to speak to my dad again, or will he just be laying there asleep?
Levels of palliative sedation do vary. Ideally, palliative sedation is provided in a fashion that is titrated to a minimal level that permits the patient to tolerate unbearable symptoms. So degree and amount of sedation are really dependent on the individual.
Okay, so we're actually just making him comfortable and able to deal with his pain. So why is this such a controversy, and what are the issues?
So the three main ethical issues that people have problems with palliative sedation are the bioethic principles, the doctrine of double effect, and the artificial nutrition and hydration. The biomedical ethics are really just asking if the patient's judgment is impaired. Is this therapy relieving suffering or speeding up death? And is the doctor actually harming them instead of helping them? The DDE is really just an ethical justification that palliative sedation may speed up death. It provides that with some forms of end-of-life practices, it is not possible to avoid harmful actions. Really, the good needs to outweigh the bad. And because of the DDE, the Supreme Court had to really make a distinction between speeding up death and using measures to alleviate suffering. So artificial nutrition and hydration, when patients are sedated to unconsciousness, they won't be able to eat or drink without the provision of artificial nutrition and hydration. It is the individual's decision if they would like to have this or if they would like to not. This is because without it, death from dehydration will occur in 2 weeks. So death from dehydration is not the result of the underlying cause of the illness. So that's where the ethical issue comes in. But also, if they do use it, it may extend their dying period, and it will also increase the cost of their care. So just a few ethical problems with this.
So, if my dad does undergo this treatment, what laws and regulations are in place to ensure that he is getting the best treatment?
So we use the NCP, which is experts in palliative care and hospice care, and they provide great guidelines on providing these types of cares to patients. So the federal law does define palliative care, but federal policy makers are increasingly shifting risk and responsibility for healthcare to the states. So it's very state specific. Virginia, palliative care is defined in the Virginia Code and the Administrative Code within the hospice program licensing section, which is very interesting because all hospice care is palliative care, but not all palliative care is hospice care. In addition, the state Medicaid program considers palliative care to be a covered service for reimbursement base.
Thank you so much for coming in and explaining everything to me. I feel a lot better about this decision and actually do feel like it's the best thing for my dad.
You're welcome. In order to change perception on this specific topic, I believe nurses lead and can transform palliative care best. They have such a profound role in the care of individuals and families. Nurses are often the first to recognize palliative care issues and needs, and also play such an essential role in advocating for palliative care services. Also, I think like the biggest thing is that they can educate patients about the characteristics and the value and really what palliative care is. In order to implement this change, I think nursing school curriculum needs some changes. Increase palliative care content on NCLEX, continuing education on palliative care content, really advocate the use of the NCP guidelines and policies, and practice standards to develop resources and position papers to support and advance primary palliative nursing, help fund, develop, and evaluate innovative palliative care models, and address practice barriers and develop initiatives to implement primary palliative care. Overall, position the nurses at decision-making and policy-setting venues to help address the palliative care needs of individuals.